Friends, thank you so much for being here. Uh, my talk today isn't just about policy, it's about life and death and freedom and what justice asks of us as a community. We focus so much on social justice as a church, and justice asks us a lot. So when we talk about reproductive rights, we have to ask what really shapes a person's ability to make choices about their bodies and their futures. So like when we talk about, abortion and birth control, we tend to think about, women and people with uteruses, but everyone should have the right to make choices about their bodies and their futures. And we see that happening with the immigration crisis right now, people's bodily autonomy and their right to be in a space and the right to choose their own futures. That's another example of how this is so intersectional. Because and access to healthcare in particular and anything else, it's not the same for everyone. You have race, class, gender, culture, immigration status can all determine whether someone can find a provider, afford care, or even feel safe walking through the doors of a clinic. And we also need to think about what true access looks like. How can we make sure that every person, regardless of their backgrounds or circumstances, can reach comprehensive, affordable, and compassionate healthcare services? And finally, we can't forget about education. Comprehensive, medically accurate education is not just a nice idea. It's one of the most powerful tools we have to equip everyone in the communities they live in to make informed choices, reduce harm, and protect their health. And these are the threads that I would love for us to hold on to as we look at the crisis that we're in now and as we imagine what justice requires of us moving forward. So, when it comes to reproductive care, why should anyone care? Right? So I just asked, what actually shapes a person's ability to make choices about their body and their future. So let's start with the bigger picture. Right now, more than 62 million women and girls live under abortion bans in the United States. That means that an entire generation of people growing up in the US where basic healthcare decisions are denied or criminalized. And this isn't theoretical, this is a daily reality for 1 in 3 women of reproductive age in the United States. There are also things called contraceptive deserts, which with nearly 19 million women living in counties in the United States where they can't access the full range of birth control methods. And that doesn't just mean inconvenience, that means that people might be forced to wait months for appointments. They might have to travel long distances, pay for childcare, or take unpaid time off work to get the care they need. And those barriers add up, which puts health and safety at risk, and stability at risk as well. And when contraception is denied or restricted, the consequences are deadly serious. Researchers project that 4.2 million unintended pregnancies and more than 8,000 deaths from complications of pregnancy and childbirth are coming. And that scale of harm that we're talking about, or that's the scale of harm that we're talking about when we allow ideology to override medicine and science. And then finally, there's the economic cost. Abortion bans in 17 states are costing the United States $6.1 billion every year in lost wages and reduced workforce participation. And that's not just individual suffering, that's whole families pushed further into poverty, communities losing workers, and our economy becoming less stable. And these numbers remind us that this isn't abstract. Reproductive rights isn't abstract. It's life and death and justice. And they translate into whether pregnancies are safe, who has the right to plan their own futures, and which families fall into poverty. And the bottom line is this affects everyone, even people who don't have children or a uterus, because it shapes community health, household economics, and our shared freedoms. Okay. So I want to set the stage briefly. This is a map, the most current map I could find of the state of abortion bans in the United States, and you can see the color grid there. So I want to set the stage with Roe v. Wade back in 1973. That Supreme Court case recognized abortion as a constitutional right. And it said the right to privacy included the decision whether or not to continue a pregnancy. And in 1992, Planned Parenthood versus Casey reaffirmed Roe, but gave states more leeway to regulate abortions as long as they didn't impose on what the court called an undue burden, which is still kind of vague and has been interpreted many different ways in smaller courts and lower courts. And that's when we began to see waiting periods, parental consent laws, and other restrictions piling up. In 2022, the Supreme Court's Dobbs versus Jackson Women's Health, overturned Roe and subsequently Casey. And for the first time in almost 50 years, the Constitution no longer protected the right to abortion and true bodily autonomy. And that ruling didn't just change the law, it erased a federal right and left everything up to the states, which in many states had what we call trigger laws, which are bans written to take effect automatically. So as soon as Roe fell, these laws went into effect. And within days, abortion became illegal across many states in the South and in the Midwest. And other states rushed to pass new restrictions like 6-week and 12-week bans, often so early that many people don't even know they're pregnant yet. And actually, on October 1st, South Carolina, I think the state court in South Carolina is going to hear a ban that completely eliminates abortion access, period, and would criminalize providers from even providing that service or talking about that, offering that service. So what we'll see most likely, since Charlotte is a border town, Charlotte and other border towns are going to see a lot of folks coming up from South Carolina to get access and get care. So this is unprecedented in modern American history because rights are not applied equally across the country. Your healthcare, your ability to make decisions about your family and your survival in a pregnancy, all are now dictated by where you live. And abortion rights and reproductive rights in general are no longer guaranteed equally, which create deep inequalities in healthcare, freedom, and justice. And to have an intersectional moment, the states with the strictest abortion bans often correspond with states that restrict other rights as well, not just reproductive rights. Can everyone see, is because I've got my black screen share bar. Can everyone see the bar, or can everyone see the screen?
I can see the screen.
I want to make sure I'm not blocking anything. Okay, perfect. Thank you. I just want to make sure the screen's not blocking anything. So when abortion is restricted, it doesn't just affect those, seeking abortions. It reshapes how all of reproductive healthcare works, with often devastating results. And we talked about the maternal mortality rates. We talked about some other stats on the other slide, but specifically in states with these abortion bans and the ones that are getting worse, maternal mortality, so maternal deaths through like pregnancy and childbirth, is 62% higher than in states that do have access. And that means that pregnant people are nearly twice as likely to die during pregnancy, childbirth, or the postpartum period, simply because of where they live. And honestly, I think that's just white women. If you are a woman of color, the statistics are even worse. The state of maternal care in this country is abysmal. And part of that reason is because doctors are forced to hesitate, to wait until a patient is sicker or until a fetus is no longer has a heartbeat before intervening. And those delays cost lives. And we'll talk about some of those examples in a minute. And it's not just mothers that are affected, it's infants. After Texas passed its ban in 2021, infant deaths rose by more than 13% in just 1 year. And that's more than 250 additional babies that might have survived if their families had been able to access care. And abortion bans don't protect life. They create environments where pregnancy and childbirth are more dangerous, not just for mothers, but for their babies. And there is a human cost to this. They're not just numbers. These are human beings we're talking about. Amber Nicole Thurman was only 28 years old when she died in Georgia. She came to the hospital experiencing miscarriages because the state had a 6-week ban. Doctors delayed the standard procedures that she needed. And those delays lasted more than 20 hours. And during that time period, she developed sepsis and died. And a state investigation ruled her death was preventable. And then Amanda Zarowski was 18 weeks pregnant when her water broke because there was still a fetal heartbeat. And doctors in Texas refused to perform the abortion that would have protected her health and saved her life. Instead, but she was forced to wait until she developed a severe infection. She did survive, but the infection permanently damaged her reproductive system and may prevent her from ever carrying a pregnancy to term ever again. And then, I don't know if folks remember Adriana Smith. She was declared brain dead while 9 weeks pregnant in Georgia. This was just recently happened. Even though she had legally died, doctors kept her body on life support for months because there was still a fetal heartbeat activity. And the family wasn't given a choice. The law required it. Adriana was treated like a vessel and not a person. These are not isolated tragedies, and they are the predictable outcomes of laws written without regard for medical reality. And each of these women had their dignity and their humanity denied. This is the human cost of abortion bans. And these were wanted pregnancies, but they were not able to get the care they needed. And these stories illustrate how vague laws are forcing doctors, vague and restricted laws are forcing doctors into impossible situations because they could be penalized, they could be sent to prison. Thus, waiting until people are sicker and actually experiencing real harm. There's a human cost to this. And it's also affecting contraception. The attacks don't stop at abortion. This year, the Trump administration recently defined IUDs and even birth control pills as abortifacients, which basically saying that birth control pills and IUDs, which are intrauterine devices, they cause abortions, which is not scientifically or medically correct, but that's their agenda. And by twisting language, they've opened the door to restricting and banning some of the most common forms of contraception, which tie back to their strategy. There's an overarching strategy. They do this across the board. By redefining things, they erode trust and access. And we've already seen the consequences. NPR reported that thousands of doses of contraceptives were destroyed in a warehouse in Belgium because funding was withdrawn. And that was medicine that people needed, all because of politics. Planned Parenthood and the National Women's Law Center have tracked years of attempts to chip away birth control access, from attacks to Title X family planning to efforts to roll back the Affordable Care Act's contraceptive mandate. And if they can redefine birth control as abortion, they can ban it altogether. And if contraception is restricted or banned, we're not talking just about inconvenience. We're talking about more unintended pregnancies, more unsafe pregnancies, and more unsafe situations, and more strain on families and lives lost. This is about power and control over people's futures, and we cannot ignore it. So on the last slide, I just talked about how contraception itself is under attack. But this is about what happens when if those attacks succeed. So the political strategy here is to blur the line between contraception and abortion. And by labeling IUDs or emergency contraception as abortion, lawmakers can chip away at birth control access under that same manner. And this creates fear and confusion, and providers don't know what's safe to prescribe. Pharmacies are already actually refusing to fill prescriptions, patients being denied care or told to come back later. And these delays and denials mean that people lose control over their reproductive choices. And the consequences are immediate. There's more unintended pregnancies, more health risks, more inequality. And those with money can travel or pay out of pocket. Those that don't have those privileges are forced to carry pregnancies they didn't choose. And this isn't an attack on abortion, or this is not just an attack on abortion. It's about dismantling the entire infrastructure of reproductive health care. And contraception, something that 90% of women use at some point in their lives, even religious women, 98% of practicing Catholic women have used contraception. This is now at risk. So you have Andrea Anderson from Minnesota. She went to Walgreens for emergency contraception, and the pharmacist refused, citing his personal beliefs. She was forced to drive 100 miles to get the contraception that she was prescribed by her doctor. The court later ruled this was discrimination. And there's two anonymous cases. The first one from Mississippi. She was a new mom who was denied Medicaid coverage for postpartum contraception. She had just had a baby. Her provider told her that if she wanted an IUD, Medicaid wouldn't cover it and she'd have to pay cash. IUDs out of pocket run around $1,000. Just weeks after giving birth, she said, I don't have that kind of money. This is the kind of stuff that's happening right now. And Texas, in the case in 2023 in Texas, right after Dobbs, women reported pharmacies refusing to dispense contraception. There's one woman that said, that told the Texas Tribune, I felt like they were deciding for me whether I could prevent a pregnancy. And providers confused about legal risks left patients with no clear path to care. So when contraception is politicized, people are denied timely care. And these cases show us the pattern of refusal, cost barrier, and fear. And the result is more unintended pregnancies and preventable harm. So, Wedge would be our interfaith, but we all have faiths that we believe in some way. And many faith traditions call us to protect the vulnerable. And the faith traditions here at Wedgwood especially call us to protect the vulnerable and to show mercy. When someone is facing a medical crisis in pregnancy, where they're bleeding, sepsis, a miscarriage that isn't being completed, delays in care are not mercy. They are cruelty. Faith calls us to respond with compassion, not with barriers that deepen suffering. Respecting conscience means trusting people to discern medical decisions for themselves. Every major faith tradition has some teaching about free will, conscience, or the sacredness of choice. And when government step in and override personal discernment, it violates this moral agency and undermines spiritual integrity. Families thrive when they have access to reliable care and contraception. When parents can decide if and when to have children, families are healthier, more stable, and better able to flourish. And this isn't just about healthcare outcomes, it's a pastoral and community and ministerial outcome. It's about protecting the conditions where love and care and family can grow. And in a multi-faith nation, well, what should be a multi-faith, interfaith nation where you have freedom of religion means more than one theology. One denomination's interpretation of scripture should not be written in law for anyone else. True religious freedom means making space for all traditions and for those with no religious tradition to follow their conscience in making medical decisions. And when one theology governs all, that's not religious freedom, that's religious discrimination. And that religious discrimination, we'll go into that in another slide, that's affecting everything. It's affecting LGBTQ rights. It's affecting reproductive rights. It's affecting, frankly, immigration rights. It's affecting access to safe and healthy communities and environmental justice. It affects it all. This is why people of faith like us must speak up, not in spite of our values, but because of them. Protecting dignity and conscience and well-being and true religious freedom is the moral responsibility of communities like ours. So what can congregations do? How can people put faith in action? Faith communities can educate and accompany and provide resource for people. And in particular for people who's navigating bans, right? They can host teach-ins and like Wedgwood does an incredible job of this, of educating people. The way we bring in guest speakers and have different topics every Sunday. We do such a great job of this. And I think we provide that model for other people. Congregations can host teach-ins where people can learn about what's actually happening in our state. Pastors and rabbis and scholars can speak out. It's so powerful. They can offer pastoral care nights where people can talk about the spiritual and emotional weight of reproductive decisions. And it also means resourcing folks practically, pointing them towards resources. Charlotte has 3 clinics that provide abortions. There are more clinics that provide contraceptive access. There are also funds and organizations like the Reproductive Rights Coalition, Charlotte Reproductive Action Network, the Carolina Abortion Fund, and so many others. There are also interfaith coalitions that do reproductive justice work. It could also mean helping people get rides, housing, childcare, or just showing up in solidarity, doing counter protests. And then interfaith public witnessing is powerful when clergy, in particular, and congregations show up at the legislatures or testify in hearings or stand outside clinics in solidarity. And lawmakers actually notice. They do, they notice. And it makes it harder to claim, especially on camera, if it's a partisan issue, when they see faith leaders and everyday people of faith standing together for compassion based care, because it tells a different story that is justice rooted and care rooted, not something that's rooted in control. Because ministry should be rooted in hospitality, relief, and truth telling. This is ministry, creating safe spaces for people under stress, stepping in with practical help when systems fail, and naming the fear and cruelty and policies that cause harm and pointing instead towards mercy, compassion, and justice. In a fearful time like this, faith communities can be the presence of courage and care. And when congregations act, they not only change lives in the moment, but they also reshape the public narrative. Faith is not the property of those who restrict and punish. Faith is a force for freedom, care, and flourishing. So I know we're all familiar with Christian nationalism, um, but some folks might not be. But Christian nationalism is this idea that thrives on the idea that faith and freedom, reproductive freedom, are incompatible. They have their own ideas of freedoms, but that freedom is actually discrimination against other people who don't believe as they believe, right? But their beliefs are false binaries. That if you're a person of faith, that you must support coercive religion into law. That's false. You can be deeply rooted in your faith and stand against laws that force one theology on everyone. And in fact, for many of us, it's because of our faith that we resist. Our traditions call us to justice, compassion, and the dignity of human choice. And when we resist Christian nationalism, we're not just defending reproductive rights, we're defending religious freedom. And that includes freedom for Christians who don't want their faith weaponized, freedom for Jewish people, for Muslims, Hindus, Buddhists, the non religious, everyone. True religious liberty means no single theology gets written into law, and we must respect and defend everyone's freedom by resisting theology by state. And our witness has to be different. We have to tell better stories. Where Christian nationalism offers punishment, we proclaim mercy. Where it seeks to control, we protect care. These are faith values too, and they are stronger than fear. I know there's a lot to be afraid of, but our values are stronger than our fears. And when we live them out, we remind people that faith is not the enemy of freedom. Faith can be its greatest ally. And when we resist Christian nationalism, we do it as people of conscience and people of faith. We do it not against religion, but against coercion, and we do it in the name of mercy, truth, and care. And reproductive justice is one of the frameworks that we need to hold on to. It was created in the 1990s by Black women activists, including leaders like Loretta Ross, who saw that the mainstream pro-choice conversation at the time was way too narrow. And this framework expands the conversation beyond abortion. It says justice is about the right to have children, which means access to prenatal care, maternal care, and support systems, and the right to not have children, which means access to contraception, abortion, and medical autonomy, and the right to raise children in safe and healthy communities, which means housing, food, clean water, safety from violence, and freedom from state surveillance and criminalization. Loretta Ross really put it best when she said, reproductive justice is not just about the right to abortion. It's about the right to maintain personal bodily autonomy, to have children, to not have children, to parent the children we have in safe, sustainable communities. That's what justice looks like. It's not just survival, it's not just scraping by, but the freedom to live whole and dignified lives. And this framework links reproductive justice to racial justice, economic justice, community safety. It's the holistic intersectional vision that we need. So even if you will never need an abortion or contraception, bans ripple through workplaces, hospitals, and families. When people can't plan pregnancies, they're more likely to leave school early, to lose income, and fall into poverty. And that hurts entire communities and our economy. And when governments control our bodies, other freedoms become negotiable. Today, it's abortion and contraception, and also, frankly, free speech with what's going on too. Voting rights, or the freedom to marry, or the freedom to cross state lines. Bodily autonomy is the foundation for other rights. And justice is everyone's business because community health depends on it. If your neighbor can't access care, it affects your hospital system, your tax dollars, your community stability. Reproductive freedom saves lives, lowers healthcare costs, and keeps families together. So whether or not you will ever need an abortion or birth control, you have a stake in this fight because reproductive freedom doesn't just protect individuals, it protects all of us. Educate. Justice demands action. We start with education. We share the stories of Adriana Smith in Georgia, or the Mississippi mother in 2025 who couldn't access contraception. These stories, these human stories, open eyes. And education means pushing back on information with facts and compassion. And in an interfaith community like ours, education is spiritual framework, reminding each other and each of us that truth telling is holy work. And support. We support each other and those just most directly affected, whether it means by giving to funds, helping travel costs, providing meals, housing, childcare. Support is how we put hospitality and solidarity into action. And we engage publicly. That means voting, lobbying, testifying at hearings, calling our lawmakers. It also means using our voices as people of faith to demand policies rooted in compassion, not coercion. Our witness matters when lawmakers assume faith is only on one side. And we build. We connect reproductive justice to immigration rights, LGBTQ rights, racial equality, climate justice, and so on, because all of these struggles are about dignity and survival. Coalition, intersectional work is how we shift power. And it's how we make sure that no community fights alone. This is the work that Wedgwood is called to, and the work that Wedgwood does. We educate, we support, we engage, we build. Each one of us has a role, and together we turn faith into justice and justice into change. So I just want to really briefly say reproductive justice is not a privilege, it's a right. And Monica Simpson, who's the current executive director of Sister Song, reminds us that reproductive justice is about the human right to self-determination. And this is our shared work to make what is right real in people's lives, to stand not just for privilege, but for justice, and to link arms across movements and insist together that dignity, compassion, and freedom are non-negotiable. So I began this talk by asking, what really shapes a person's ability to make reproductive choices? We've seen that it's not just about laws on paper, it's about economics, race, gender dynamics, immigration status, cultural barriers, all these things that keep care out of reach. I also asked how we can make sure everyone, regardless of circumstances, has access to reproductive health services. But the truth is, access won't come from courts or politicians alone. It comes when communities like ours insist that no one is left behind, whether that means funding abortion care, showing up at the legislature, or creating networks of mutual aid. We asked about the role of education, and we know the answer. It saves lives. When people have accurate, age-appropriate information, they can make informed choices. And when they don't, we see more unintended pregnancies, more unsafe situations, and more harm. So, as we close, I want us to carry. We're gonna open up for discussion in a moment, but I want some things for you to think about. What role will you play? Will you speak out? Will you support? Will you build? Each of us has a piece, and together we demand a future where every person, no matter where they are or where they live, has the right, the knowledge, and the freedom to make their own choices. So, I know that was a lot. And I tried to go through it quickly, not to, make it super, super long, because I've given really long ones in the past. But I would love to hear from folks. How can we live this out at Wedgwood? Or how do we live this out at Wedgwood and here in Charlotte? How do we live out justice and education and support? How do we live those things out?
I think we have to not be afraid to speak up and express our beliefs. Sometimes it takes courage, but if you have facts, if you know what you're talking about, and we all should, and this morning you gave us some facts, go home, look it up, read it. If you know your facts, you should feel confident in speaking up. And I don't know if you said this or not, but the United States has the highest infant mortality rate of any developed nation in the world. That is just staggering.
Yeah.
One of the things that I think gets lost in this conversation is that nobody wants to have an abortion.
Right.
The people I know that have had abortions, it's a very traumatic event.
Yes, it
So
is.
for me, one of the more effective slogans I've heard is that abortions should be legal, free, and rare.
Mm.
In order to make them rare, there has to be an emphasis on education, ability to access contraception, how to use contraception, all the medicines that are available to prevent unwanted pregnancies. So I think people sound like they're advocating abortion, but nobody advocates abortion. Abortion is a terrible procedure that people have to go through. So it's not something that people want to do. It's something that we should try to avoid and give people choices to not be in the situation where an abortion is the only option.
Mhm.
Mm.
Yeah, and there's a lot of complicated feelings, and thank you for bringing that up. And one thing I didn't mention, but I was trying to figure out where to put it. But you know, does anyone know that what the largest demographic of women who actually get abortions is? Does anybody know?
No.
It's women who already have children.
Yeah.
They already have children. That's the largest group of people that have abortions,
Mm.
and it's complicated. An abortion should be freely accessible. There is this misconception that, you know, abortion is used like birth control. No, it's not. It's for one, it's way too expensive for that. And as Tom mentioned, it's too physically traumatic for that. It's too expensive. That's not actually rooted in any sort of fact, but that's a misconception. Um, and it, and to Thomas's point, when I was working, you know, daily in this world, I would often, you know, give this analogy. Women don't end up at abortion clinics like we got lost going to the mall. That's not how it works. You go to an abortion clinic because that's where you're going, because you need care. You don't end up there by accident. And so it is about the right to autonomy and you know, correcting those misconceptions.
I would like to say that when I worked at Queen City Assisted Living, Liz was really supportive and would bring condoms and other things to support the residents and make sure that they could have safe sex. And she did some educate I know she did an education session with the group, and I think that's something we can do is support efforts to provide contraceptives to
Right.
people who can't afford them.
Right. In education.
Mhm.
Yeah. I forgot to mention, I want to mention it now. So I'm on the board of the Reproductive Rights Coalition, and we have access to free emergency contraception. I have probably about 50 boxes at my house of emergency contraception that I can give away for free. So if you know of anyone who needs it, they don't need to go and pay $50 at CVS or Walgreens. I can give it to them for free, no questions asked. And I can get more if folks need.
Okay, that's good to know.
Yeah.
Thank you so very much, Liz. And what is our call to action today, Wedgewoodians? What are we going to do with what we've learned today?
Pass the information on to whoever, you know, I have a young teenage granddaughter. I'm thinking about her as she was giving all this information. I'm looking on the map, like, where she live? What color is that? You know, if, you know, I mean, I don't know what can happen. She's 14 years old. I mean, 15 years old actually next week. So, you know, kids are going to be kids and girls are going to be girls and boys are going to be boys. So, yeah, spread the information. Knowledge is the key. That's always the key, you know.
And there
Yeah.
are opportunities to be escorts at the clinics, and that is you just walk the person in from their car to the door.
Mm-hmm.
Because most of the time there are some protesters out there, and you just walk them from the car to the door, carry on a little conversation with them so that they are not freaked out by protesters. And there's usually a Catholic priest out there almost every time. And he's got his collar on and everything. So that's a wonderful opportunity to help one day a week.
Yeah, and they usually are going by themselves.
Yeah.
Yeah.
Which can make it even harder.
Mm-hmm. Well, Liz, you know, thank you for that presentation. And that was a lot of information, like you said, but it's needed information. We need to keep abreast of that.
Liz has our
Beautiful.
closing words.
I did what- Yes, and before I do that, I want to say, Shay, I actually thought of you yesterday because I was at Union Presbyterian Seminary at Liberating Theologies yesterday, and I've been thinking about it. It was so powerful, and I think what we at Wedgwood do is very much liberation theology in the ways that we put our actions where our words are. We really, really do, and as we move into it was a really powerful day, and it was one of the best I've ever been to. It was excellent. But as we go into this coming week, may you go from this place with courage in your heart and justice in your hands. May we be a people who honor dignity, defend freedom, and practice compassion. And may our lives together be a witness that mercy is stronger than fear, truth is stronger than lies, love is stronger than control. Go in peace and go ready to build a world where every person, not just the straight, white, United States born Christian man, but every person can flourish. Thank you.
Thank you.
We extinguish this flame, but we keep the light in our hearts. With this message of love and justice, taken outside these walls in which we live in, until we see each other again. Amen, Ashe, and may it be so. Now go in peace. Ashe.
Thank you, everyone, for a beautiful service this morning.
Yes, it was.
Just
Very nice.
thank you, and have a wonderful and blessed and great week. And leadership is staying on for about 5 minutes after we got a quick discussion to have.
Okay,
So
and if
thank
anyone
you
needs
all for being
anything,
here.
if anyone needs anything, raise your hand.